How do fallopian tube cilia impact fertility? Imagine tiny hair-like structures lining the inside of your fallopian tubes, working tirelessly to help you conceive. These are called cilia, and they play a vital role in female fertility. Their main job is to move the egg from the ovary toward the uterus, where fertilization can happen. When you ovulate, the egg is released into the fallopian tube at the end called the infundibulum. The cilia here beat in a coordinated wave, creating a gentle flow that captures the egg and guides it along the tube. This movement is essential because it ensures the egg reaches the site of fertilization, which is usually in the ampulla of the fallopian tube. If these cilia are damaged, absent, or their beating is disrupted, the egg may not be properly picked up or transported. This can lead to infertility because the egg might stay in the ovary or fall behind in the tube, preventing fertilization. Animal studies have shown that when cilia in the fallopian tubes are not functioning correctly, eggs are left uncollected, and fertilization cannot occur. This highlights how crucial cilia are for the early steps of conception. Beyond helping with egg pickup, cilia also assist in moving sperm and early embryos along the fallopian tube. However, their role is most critical at the beginning, where they help capture and transport the egg. The movement of sperm and embryos relies more on the muscular contractions of the tube, but if cilia are not working properly anywhere along the tube, it can cause problems. These issues can lead to infertility or increase the risk of ectopic pregnancy, where the embryo implants outside the uterus, often in the fallopian tube itself. Cilia beat in rhythmic waves, creating a flow that helps move the egg and embryo forward. The number and activity of ciliated cells vary along different parts of the tube and can change during the menstrual cycle. Proper cilia function depends on healthy cellular energy and ion channels that regulate their movement. When these processes are disrupted, cilia become less effective, impairing their ability to move the egg efficiently. Certain conditions can damage or impair cilia, leading to tubal factor infertility. Infections, inflammation, and conditions like endometriosis can cause scarring or inflammation that affects the tubes and their cilia. Endometriosis, in particular, can lead to tissue scarring and inflammation that damage the cilia, even if the tubes are not completely blocked. This damage can slow or stop the movement of the egg, making conception more difficult. Genetic disorders like primary ciliary dyskinesia also affect cilia function throughout the body, including in the fallopian tubes, and can cause fertility issues. In summary, fallopian tube cilia are essential for fertility because they help capture and transport the egg to the site of fertilization. Damage or dysfunction of these tiny structures can prevent the egg from reaching the uterus, leading to infertility or increasing the risk of ectopic pregnancy. Understanding how cilia work is especially important when evaluating conditions like endometriosis, where tubal and ciliary health may be compromised. If you're experiencing fertility challenges, consulting a healthcare professional can help determine if tubal or ciliary issues are involved and guide appropriate treatment options.